In Ipsos polling exclusive to Global News, while 73% of the population is vaccinated, 18% say they are still hesitant, with 9% unsure if they will get the shot, and another 9% saying they're definitely not. But incentives like a lottery prize could shift those numbers. Of those who haven't got the shot yet, 55% say they would be convinced for a chance to win $1 million. But nearly as many, 54%, say a lottery prize of just $100,000 would do the trick.
It's a suite of these types of things that could have an effect. And, even when we tested them in the survey, that group that was kind of, I'll get around to getting vaccinated, it was more encouragement for them. So that last 10%, the people that are really, truly, I'm not ever going to consider this, there's really little incentive that you can offer to them to get them on side. This is a philosophical point for them. It's maybe a medical point for them. There might be, maybe even an ideological point for them that they don't want to be vaccinated. But that other 10% that are just sort of saying, yeah, I might get around to it. I'm not really convinced. Those people, a whole package of these different incentives are not necessarily a bad idea. The biggest issue with vaccines today is not hesitancy. I mean, it's an interesting topic to get to, and it's kind of a last mile topic in this whole discussion. The biggest issue we're still dealing with is availability. So we've seen over the space of the last several months the desire to get vaccinated jump up, and yet still we see big lineups and restrictions on exactly who can be vaccinated. So the biggest problem that we're dealing right now is matching up the supply we have to the demand. No doubt about it. It's becoming less of a problem every day as more vaccines come in. But at some point, and we're not there yet, we're going to run into this issue of hesitancy. And there'll be a combination of two things that reduces that group even further. One of them will be just experience. The more people that they know, the more people that, their families and their close social circles that get vaccinated and are okay, that will convince them to try things on themselves. And then the second thing will be we're going to start to see, because we're seeing this already in the polling data, people starting to believe that demanding vaccine to do certain things in society. I mean, we saw an announcement today from one of the playhouses in New York City about not allowing people in who didn't have a specific type of vaccine. I mean, we're going to start seeing restrictions at various places about people's ability to travel or use certain types of facilities, take advantage of certain types of fun things that we all like to do. And unless people are absolute hermits, that this will be another thing that pushes them into considering being vaccinated. So I still do think that the data are showing that there's way more opportunity to vaccinate people today than there is a need to really focus on convincing people that they need to be vaccinated. That number that I quoted before, 5-10% that would absolutely under no conditions say that they would have a vaccine is unchanged. What has changed is vaccine acceptance has gone way up. So when we first started asking these questions, when the idea of a vaccination being one of the solutions to the pandemic started to become more realistic, you saw there was a lot more hesitancy. And the reason was, and people were quite explicit about this, was that they viewed it as something that had been developed really rapidly, which gave them concern. And they also worried about some of the political motivations behind the players who were touting vaccinations the most. And the third part of that was that they really didn't see any community-based experience with the vaccine. So in order to be able to feel like it was going to be safe, knowing that somebody that you knew had already received the vaccine and it had all gone acceptable for them, those cases of personal experience and demonstrations of personal safety just didn't exist. So well over half of the population was pretty hesitant when we first started talking about this. Now we're talking about numbers that are more like 20%. So we've made a lot of progress on this issue over the space of a very short period of time. If you take a look at what the numbers are being reported by various levels of government and the level of vaccine uptake, it's very similar to what we found in the poll. So there's a triangulation here of all the data. Yeah, there are in some countries, and we usually point out the United States, but we do this type of research globally, and I can tell you there's big concerns in places like Japan, for example, and in Russia. There's big concerns about vaccines. So it's not exclusively an American issue, but since they're next door, it's the one that we pay attention to. The other point that I would make is that there's a difference between vaccine hesitancy and vaccine denial. So if we're saying roughly 20% of the population is hesitant to get a vaccine, there's all sorts of reasons that they may be hesitant, from they can't get access to vaccines through to some people in an altruistic way say, I think other people are more deserving and need to get it before I do. There are other people that, still want to see more evidence or remain to be convinced. But the true group of people who are really on the edge of this, depending on any poll that you look at, is usually 5 to 10% that say, under no circumstances would I get a vaccine. And if you can get up to 90% in any jurisdiction, I think most epidemiologists would say we're doing pretty well.